So dementia and delirium are completely different things. So for example, they may present the same to somebody who doesn't know that person. So you would be you could present as quite confused, you could present as quite lethargic, you can be quite irritable, agitated. There's a whole host of symptoms. So dementia is a condition that usually progresses over a very long period of time. They may not, it may not even cause them any problems for a number of years. Usually family members might notice that they're not quite themselves. Whereas delirium is rapid onset, where they would just present as extremely confused or agitated, just different to themselves, really quite quickly. So when diagnosing a delirium, you would always look at the onset, you would always look at what the person's norm is, what's normal for them might be very different for somebody else. I think it's important to remember as well that older adults with a dementia, a diagnosis, whether it's diagnosed or undiagnosed, are most at risk of a delirium. And it can be most distressing for that person because not only do they have the symptoms of the dementia, they also have on top the delirium symptoms, which can be extremely distressing and disorientating for the person. So it's really important that an early diagnosis and treatment is carried out for the delirium. Spotting delirium can be really difficult for health professionals, particularly if they don't know the person very well. They may feel that the person has an undiagnosed dementia, or they may already have a diagnosis of dementia. So spotting a delirium can be difficult because they don't know what that person's baseline is, they don't know that it's out of the normal for that person, they don't know what they can previously do, they don't know what how well they've looked after themselves. This is where family and familiar carers and friends are so vital to helping to diagnose delirium and getting the treatment that's necessary really quickly. Family members, familiar carers and friends know the person best. They know what that person's normal routine and generally what their levels of confusion are. So if there is a change, family friends and familiar carers need to report that to the health professionals as soon as possible. That information is absolutely vital to the early diagnosis of a delirium. Yeah, so sometimes a delirium can present and that might be the first sign that something's medically wrong. So it needs to be taken seriously, and health professionals will then investigate and look for the medical cause of the delirium, which can be a number of different things. But usually with the delirium, once it's diagnosed, once the medical cause has been identified and treated, it will subside. If somebody has a delirium and they're in hospital, a change of environment can be really quite distressing to that person anyway. They're in an unfamiliar surroundings. They're not the best places for when people are really quite confused and they may be distressed. So a really helpful thing to do is to make sure that they have their hearing aids, their glasses, a clock that they can see what time of day it is, ensure they've got access to good food, plenty of fluids, spend a bit of time with them, reorientating them, explaining where they are, why they're there, maybe even pictures as well of family members, signs to say what's happening, what's going on, because it really can be quite distressing for the person It's also, I'm sure that the health professionals would consider this, but good pain relief, making sure that they're not in any pain, encouraging them to have a really good sleep routine. Are they comfortable? Are they too hot? Are they too cold? There's lots of different things that can be done where you can support your loved one in hospital. Have they got their familiar items, books that they like, crosswords, anything at all that's familiar. Also encourage them to get up and move and walk around, go and get a drink, you know, try and encourage them to be out of bed and to get active.